Hello everyone. Bismillahirrahmanirrahim. I am starting with the lecture number 9 on the series of Asphyxia. And the learning objective of this lecture will be that I will be discussing strangulation, which is an mechanical asphyxial death, where the constricting force is directly on the neck, not the weight of the body. The learning objective of this lecture will be I will be discussing the definition of strangulation, its various means, that is by means of ligature, by means of hands when it is called throttling, by means of elbow, the neck is compressed in the elbow, that is mugging, or compressed between two hard sticks, commonly called as BANSDOLA. I will be discussing the symptoms, the mechanism of death, the occurrence, and the medico-legal aspect of strangulation. That is, it is accidental, suicidal, or homicidal. Then the mode of death and autopsy finding will be discussed about the strangulation, which are external findings on the body, on the neck particularly, and about the ligating material, which is a rope or any other material, the examination of that material. Then on external examination, there will be specific findings on the neck and non-specific finding, that is cyanosis, congestion, petechial hemorrhages, and other non-specific findings will be on the body. Then how the ligature mark will be appearing, as it is a mirror image, imprint abrasion. So the ligature mark will be studied in detail. So now starting with the topic of strangulation. This is a picture of, you can see the intact ligature with multiple turns that has been tied tightly around the neck. So strangulation is defined as a form of violent asphyxial death caused by the constriction of the neck by some means. And the constricting force applied directly on it, and it is not the weight of the body, as in hanging. The constricting force in hanging is the weight of the body. So the constricting force is directly applied on the ligating material, and it is not the weight of the body. Then ligating material can be a ligature, then it will be called as ligature strangulation. And if it is done with the hands, then it is called throttling. And if the neck is compressed between the elbow like this, then it is called as mugging. Or when compressed between two hard sticks, it is called as BANSDOLA, because usually the bamboo sticks were used. So after the name of bamboo, it was called as BANSDOLA. So now regarding the symptoms of the strangulation, there will be sudden violent compression of the windpipe, which will render a person powerless and cause almost immediate insensibility, loss of consciousness, and death. And if the windpipe is not completely closed, then the face will be deeply cyanosed and there can be bleeding from the mouth and nose and ears due to intense congestion. And the rupture of various venous plexuses can be seen above the ligature point. The hands are clenched and the convulsions may precede death. Now, regarding the mechanism of death, usually asphyxia, but other causes can be cerebral anoxia because of the occlusion of the arterial vasculature of the neck, or venous congestion because of the obstruction to the veins of the neck. But there can be combined asphyxia and venous congestion, or reflex vagal inhibition by the direct pressure on the carotid bodies, thereby excitation of the vagus nerve, causing cardiac standstill. Or the fracture dislocation of cervical vertebra, rarely it is, but if intense pressure and force is used, there can be such findings. Now, the occurrence. Accidental, uncommon, but may occur in fetus as umbilical cord around the neck, or in adults at work may occur. But suicidal is rare, and homicidal is common, also a mode of execution in Spain and Turkey. Then the mode of death. Either it is anoxic anoxia or hypoxic hypoxia. Anoxic anoxia means complete blockage, and hypoxia means partial blockage, or reflex cardiac arrest. Then the autopsy finding will be, they can be divided into external findings on the body and external findings regarding injuries on the neck and the study of the ligature mark, and then internal appearances, that is the internal autopsy findings. So regarding the external findings on the body, there are non-specific signs of asphyxia, cyanosis, congestion, edema, petechial hemorrhages will be apparent. And the extent of these signs will depend upon the cause of death and rate of asphyxial process. Longer the occlusion, partial occlusion, deeper will be the sign. When the death is from vagal inhibition, asphyxial sign will be absent. And when the constricting force is considerable, these signs will be well marked. The tongue may be swollen, bruised, or bitten between the teeth and protruded. The face and the eyes show multiple petechial hemorrhages. The injuries on the neck. These vary according to the means of strangulation, that is the method or the material which is used for strangulation. If it is ligature, if the material is a ligature, the ligature mark is seen around the neck as a depressed groove. The ligature is usually by a garment or a rope or a wire, and it may be a single or more loops. and may be situated on any part of the neck, but usually on the lower part of the larynx and the upper part of the trachea. It is continuous all around the neck, directed horizontally across. So this is a nylon tie which has been tied up horizontally. This is the imprint abrasion caused by that tie. So in the early period after death, it looks pale. Later it becomes yellowish, brown, dry, hard, and parchment-like. Along the edges of the depression, abrasion and ecchymosis are often seen. This is another horizontally placed imprint abrasion of the strangulation. The ligature marks on the neck are very characteristic. It may have single or more loops. The ligature mark may be situated at the level of thyroid cartilage or below. It is horizontally and encircles the neck completely. It may become oblique like hanging if the victim is dragged by the ligature. In hanging, it is oblique from front going backward and upward, but in strangulation, it is usually horizontal, but it may become oblique because of drag. The ligature mark is prominent on the front of the neck than on the back, where the skin is thick and tough. The character of the mark depends upon the nature of the ligature. It also depends upon the number of turns around the neck, the length of time it remains applied. So the pattern of the ligature may be imprinted on the neck as a pressure abrasion. And it is also called mirror image phenomena because it is an imprint abrasion. If the ligature has gone round the neck more than once, corresponding number of marks, one above the other and close to each other, are seen. And in such cases, there may be evidence of skin bruising or pinching between the ropes. If caught between the rounds of the ligature, it will be bruised. You can see the two imprint abrasions. Then continuing with the ligature mark, sometimes the mark is absent at back of the neck due to intervening clothes or long hairs. Interrupted ligature on the front of the neck can be due to clothing or victim's fingers trying to defend himself. The mark is usually a groove lined by plain pale brown parchment having pattern of the ligature. The presence of vital reaction above and below ligature mark confirms the antemortem nature of the ligature. So summary of this lecture is that we have started discussion on the strangulation and we have understood what is strangulation, and we have learned in this lecture what is the definition of strangulation, what various means can be used, that is ligature, hands, elbow, or any hard sticks. Then we have also understood the symptoms of strangulation, mechanism of its death, occurrence, whether it is suicidal, accidental, and homicidal. Then we have understood the modes of death in strangulation, and we have started the discussion of autopsy findings. And we have discussed the external findings on the body, on the neck, and about the ligature material. And we have learned the external appearances at autopsy on the body, which are specific signs at the neck and non-specific signs of asphyxia. And we have discussed the ligature mark in detail, and we have understood how it appears. It is a mirror image or imprint abrasion of the ligature. Thank you very much. So that's all about the lecture number 9, and we will be discussing in the lecture number 10 the internal autopsy finding of strangulation. Thank you. Take care. Allah Hafiz.